You will agree with me that the wetter, the better. The wetter, the better. That is what I just said. But I think it's high time we start normalizing sexual health and not shy about it. Because a lot of women suffer from irritation, from dryness down there, but they are scared to speak about it. Anyway, I just brought this to your doorstep. All you just need to do is to watch the video to the end. Good day, everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Messi Mary, popularly known as a nurse with a difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be sharing with you useful tips on how to stay wet during sexual intercourse. But before we go into details into this class, if you are new on our YouTube channel and these are content you are interested in, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Messi Mary saying thank you. Let's go there. All right, welcome back. I definitely know that one of the reasons you clicked on this video is possibly to have a wonderful sexual experience in your next encounter. But first of all, let's discuss. In your previous encounter, the last encounter you just had while having sex, how did you feel? Did you feel dried? Did you feel irritated? Did you feel raw that day? And you just want the whole encounter to just end because you are not enjoying the flow? And what do you think could be the reason? Feel free to drop in the comment section. I also want to let you know that being dry down there can be as a result of the factors I'm going to be listing today. And it is normal for it to happen. So being dry down there can be as a result of breastfeeding. Are you breastfeeding? It can be as a result of pregnancy. It can be as a result of some oral contraceptive or contraceptive that you are taking generally. It can also be as a result of aging, menopause, premenopause. It can be as a result of the particular time you are in your menstrual cycle. Are you close to your cycle? Are you in your ovulation period? So these are the things that are likely going to affect how wet you are during sexual encounter. It can also be as a result of the fact that you are not properly aroused as a lady. Because if you are not properly aroused, there's not going to be an increased blood flow to the genitals. So being properly aroused is one of the things we should take into consideration when it comes to getting enough lubricant down there. Some research has been done, some small studies have been done, and they found that vitamins can actually help with arousal. Like I said, it's a small study, which is of vitamin D, vitamin E, omega-3 fatty acid, which is fish oil, can help with arousal. And most people think that if they increase their water intake, it's going to increase the lubrication down there. But anyway, there is no direct relationship between your increased water intake and the lubricant you get down there. Sincerely, those are two entire things. They are different. Generally, hydration, water is good for our body. It helps to keep your organs alive. It helps to keep a lot of things going. It helps to stay active. But when it comes to lubrication down there, that is a different ball game. So one of the tips I'm going to be sharing with you is getting fully and properly aroused. If arousal is the problem, you're finding it difficult to get aroused, try a lot of things to help you get aroused. There's nothing like getting fully aroused when it comes to sexual encounter, when it comes to sexual intercourse. So when you are fully aroused, it increases blood flow to the genitals. When blood flow gets to the genitals, there's increased oxygen, there's increased nutrients down there. Let's put it that way. But if you are not properly aroused, there's not going to be an increased blood flow to the genitals, and getting wet is difficult. You may want to ask, how do I get fully aroused? There are a lot of things you can try. You can try a lot of foreplay. Your foreplays are very important. Trying to know your G-spot, trying to know what areas are sensitive in your body, communicating these areas to your partner to help you arouse is going to help you. And research has shown that using vibrators can actually help you to get aroused as a lady. So these are the things you should take into consideration. Talk to your spouse. The time is going to take you for you to get aroused. Communicate. communicate with your spouse so that they can also help you get aroused. Because when you are getting aroused, naturally your body just releases a lot of lubrications. And there's something you should also take note. Put your mind in the sex. Just program your mind. Whatsoever your name is, Mercy, Joe, I just want to enjoy this. Don't think you are doing anybody a favor involving yourself in sexual intercourse. So program your mind that you want to enjoy the flow. Program your mind that you want to go aroused. So stop thinking about anything. For the married women, you see them thinking about their kids, the clothes that are washed, the dishes in the sink. They're thinking about their work. They're thinking about how to balance while having sex. Try as much as possible to remove those things from your mind during that encounter. Trust me. Try and remove those things to your mind. Focus on why you are on that particular bed, on that particular couch, at that particular moment, and try to enjoy the flow to stay aroused. So that's the first point I have to share with you. And the second one I have to share with you is the use of lubricant. Whosoever told us that lubricant is this, lubricant is that, must have lied to you. Seriously, when you know you are not when you know you are not wet enough, using a lubricant is not a bad idea. Using a lubricant gives you a new feeling. It gives you a new sensation. It makes you feel, should I say, more alive. Let's put it that way. So as a woman, feel free to get a lubricant that you are not allergic to and use it. I've made a video on the different types of lubricants. You can actually watch these videos and stay informed and get the knowledge you need when it comes to the use of lubricant. So get your personal lubricant is very important. Then the third one I have to share with you is the estrogen. Yes, estrogen. So you see, estrogen is very important, especially women that are entering menopause or they are already in their menopausal phase. So using this vaginal estrogen is going to help you get wet. You know that as you enter menopause, as you enter premenopause, this estrogen level goes down. And this estrogen is very important for proper lubrications down there. So using of this estrogen is going to help you with proper lubrications down there. And there's also another benefit of using estrogen. It also helps to prevent recurrent urinary tract infection, which is recurrent UTI. So these are the tips I have to share with you. But you see that first tip, which is getting aroused, putting your mind inside that sex, is very important. Trust me. Because if your mind is not there, you're not going to go anywhere. Yes. Anyway, these are the points I have to share with you. Before I go, sorry, there's something I did not see, and that is the estrogen tablet. Please and please, these estrogens, these vaginal estrogens, they are prescribed by your doctors. So speak with your doctor. Don't say, no, Miss Mary said you should go and get the vaginal estrogens. You go there, you get to start using. Please, like I will always say, speak with your doctor for confirmation and guidance. All right, speak with your doctor for confirmation and guidance. So this is basically what I have to share with you today, and I believe and I hope it's going to help you if you put them into action. You can watch our videos on the various types of lubrication, how to know ovulation. We have a lot of videos on this channel. I can't even list the ones that are going to be beneficial. Practically everything on this channel is beneficial to you. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy saying thank you. Bye and see you in our next video.